Second white coat. Subscribe and like. Let's learn medicine together.
Welcome! Today, we're jumping into a fascinating medical detective story. We're going to unravel a case where the very first clue to a problem in someone's neck doesn't show up in their hands or their arms. No, it shows up all the way down in their toes. So let's just get right to it. This is the big question, the central puzzle we're going to solve together. I mean, it sounds kind of backward, right? How can a problem so high up cause a symptom so far away and just skip everything in between? Well, the answer is hidden in the absolutely brilliant and incredibly specific wiring of our nervous system. Okay, so every great mystery has a beginning. Let's meet our patient and start uncovering the clues. Our story centers on a 27-year-old man. He comes in with worsening tinnitus and hearing loss, and that eventually leads to a diagnosis of something called Neurofibromatosis type 2, or NF2. Now, the main thing you need to know about NF2 is it's a genetic condition that basically makes a person much more likely to develop tumors all along their nerves. And, while the doctors are looking into all of this, they find something else. And this is our smoking gun, the clue. What you're looking at here are MRI images that show a small tumor, a meningioma. And you can see it right where those white arrows are pointing. It's up in his neck, and it is physically pressing on his spinal cord. This is the source of our whole mystery. So to figure out how this little tumor causes its very first symptom, we've got to understand the crime scene itself, the spinal cord. And you really shouldn't think of it as just one big cable. It's much more like a massive information superhighway with all these dedicated lanes for different kinds of traffic. And the specific lanes we care about today are called the dorsal columns. These are pathways that run up the back, the dorsal side of the spinal cord. And their job is to carry very specific types of information to the brain. Things like feeling vibration, knowing where your arms and legs are without looking, and that really fine, detailed sense of touch. Now, here's where it gets really cool. This highway, it is so perfectly organized. This image really shows you that it's not just a random mess of nerve fibers all tangled up. Nope, there is a precise map. Information from different parts of your body travels in its own designated lane all the way up to the brain. All right, so let's zoom in on that map. The key to cracking this whole case is understanding the very specific layout of these dorsal columns. So the nerve fibers that are right in the middle, the most central or medial ones, they have a name, the fasciculus, gracilis. And just think about it for a second. The nerves from your toes and your legs, they have the longest trip to the brain, right? So they join the highway first, way down at the bottom, and they take up the innermost lanes. These lanes are exclusively for sensory info coming from the lower half of your body. Then, as you move up the body, you get to the outer lanes called the fasciculus cuneatus. Nerves from your torso, your arms, your fingers, they join the highway higher up. They can't get to those inner lanes that are already taken, so they just add on to the outside. So as you go up the body, the information literally stacks from the inside out. So let's just hammer this home, because this is the whole secret right here. There is a strict rule on this highway. Information from your legs and toes travels in the medial, the innermost lanes, and info from your arms and fingers travels in the lateral, the outermost lanes. This organization, it's everything. Okay, we've got our patient, we've got the clue, and now we know the rules of the road. So let's put it all together and connect this anatomy right back to our patient's tumor. Remember where that tumor is. It's on the outside of the spinal cord, and it's slowly pushing inward. Because of its location, it's pressing right on the back middle part of the cord, exactly where the dorsal columns live. And what's the very first set of nerve fibers it's going to bump into? Yep, the most medial ones. And when you lay it out like this, the logic is it's crystal clear. 1, the tumor is pushing on the spinal cord, and it hits those medial lanes first. 2, we now know that those medial lanes are carrying all this sensory data from the legs. 3, therefore, the very first, most subtle sign of a problem is going to show up in the lower body. And there it is. That's our answer. The earliest clinical sign of this tumor up in the neck is a loss of vibration sensation way down in the toes. That's the most sensitive information carried by the most medial nerve fibers, which are the very first ones to get squished. Mystery solved. But you might be wondering, why that specific symptom? Well, this table lays it all out. Vibration from the fingers, that's spared, at least for now, because those fibers are on the outside, in the lateral part. And what about other feelings like pain and temperature, or the signals for moving your muscles? Well, they travel in totally different highways in other parts of the spinal cord that the tumor hasn't even touched yet. So, okay, we've solved this one patient's puzzle, but why does this one little detail, this neurological map, why does it actually matter in the real world? Because this isn't just a cool piece of trivia for a test. This is fundamental, day-to-day clinical neurology. Doctors use this exact knowledge of the spinal cord's map every single day. By carefully testing a patient's sensations, they can figure out with incredible accuracy exactly where an injury or a tumor or a disease is located along the spine. And really, this one sentence from our source material just sums it all up perfectly. This is the big takeaway. A lesion hitting the medial part of the dorsal column will first show up as a loss of vibration in the toes. Why? Simply because that's where the wires for the lower body are. It's a direct cause and effect, all based on anatomy. So the next time you think about the human body, just remember this. It is not a random collection of parts. It is a beautifully, logically organized system. A system so precise that a simple test on a person's toe can point a doctor to a critical problem just inches away from the brain. It makes you wonder, what other incredible maps are hidden inside of us, just waiting to be read?